What's up, everybody? Let's talk about the stages of grief and dying. So this is part of the non-system section in the professional behaviors and responsibilities section. So we've heard of these because they're also the 5 stages of grief and the 5 stages of dying that people go through. Basically, it's when people are presented with a bad outcome or horrible prognosis, either them or one of their family members, and these are the steps that everybody goes through, usually in this order, so it's important to know the order of it too, but here's the order. We have denial, anger, bargaining, depression, and acceptance, okay? So these are our stages. We've probably heard of them before in other, areas of our life, but understand people can jump around between these sections in real life. In the board's land, they're going to progress through in a specific order, but you might see somebody one day being depressed about it and then angry the next day. It can happen, but just knowing that all these are part of the psychological approach to coping with and dealing with very difficult information. So understanding that there's not to take a lot of this as a therapist, you'll just notice a lot of your responsibilities, like just don't take it personally. There are patients going through some stuff. So let's talk about denial. It's pretty much what it sounds like. The individual does not believe that they either one have the condition they have, or they are not able to believe or grasp that their condition is terminal. During this stage, it is not your job to try and convince the patient that they are dying, okay? Your job is to continue to treat the patient, let them know you are a safe person to talk to build rapport and trust. They might be, asking you like, oh, do you think that they messed this up with something else kind of thing? That is also part of it. So just understanding that it's not your responsibility to continue to hammer in, yes, you're dying. It's basically to be a listening ear and just be a trusting person and continue to build rapport with the patient as they go through these stages and process their grief. Something that's good to just have in general is like have the patient be seeing a mental health therapist, but that's not exactly in any specific stage. Anger. So this is one that I just want to caution you. As a therapist, I'm gonna jump down to the last one. As a therapist, do not take this personally. Understand the patient is not in a good place to talk about their condition, and they might just want to vent about it. They might just want to just holler at any person around them that'll listen. They're really stuck in that phase about it. If they're holding in their anger and they're trying to keep it all to themselves, they're just going to boil over at some point. So the patient themselves is going to present as very angry as they begin to process their disease. They will sometimes even direct their anger at you or others, and sometimes even themselves. So let's say that the patient is, they're diagnosed with lung cancer, they were a smoker all their lives, they might be angry at themselves. And this is where you just got to kind of just take into account making sure the patient's not going to hurt themselves or others. That's something just to kind of keep in mind, but not to be shocked if the patient is expressing a lot of big emotions as they're trying to process this, anger being one of them. Again, don't take it personally. But if it's like the kind of thing where you're just basically being verbally assaulted, you have the right to walk away from this patient, not treat them then. And be just like, I can empathize with you being upset about your condition, but that does not give you the right to like yell at me. You could always use that boundary, but big thing is just not taking it personally and continue to just be like a safe place for them to vent. So bargaining is the next one. So this is basically trying to bargain with fate, saying things like, oh, okay, let's say it's our patient who's dying from lung cancer. They're like, if I pray more, like I've already quit smoking, I will do like, lung treatments. I'll donate all my money to charity, stuff like that to try to basically say like, I'm going to do a lot of good deeds so then I can be rewarded. Some patients, a lot of them that are diagnosed with cancer and a lot of pancreatic cancer patients will be like, I'm going to be super healthy. I'm going to just exercise all the time. I'm going to exercise this disease away. That sometimes does not get you the answer that they want. Do not try to rationalize with them, being just like, hey, like, you already kind of ruined your lungs smoking. Like, there's not, like, you've already, the damage is done. It can't be reversed. Like, you can't do that. Um, you can't also be like, if they're just like, do you think if I like donate all my money and I pray more that like I'll be saved? Like, don't lead into their delusions either. Even if you do believe that way, and that's totally fine if you do not lead into this patient's delusions. It will just make it harder for them to go through all the stages because they need to go through the stages in order to reach acceptance. Some people stay in certain stages longer than others, and that's not abnormal for the patient. Um, just be there for them and listen. Depression. So the patient will enter a deeply saddened state and is exhibiting all the hallmark signs of depression. So withdrawing from family and friends, not engaging in their hobbies that they used to like, or not really participating in activities that you know they used to like love, crying. Sometimes they're not eating, sometimes they're eating too much. Like it just kind of depends on their own depression response. But it's literally the same hallmark signs as like regular depression and anybody else. It's just due to the fact that they're coming to terms with their condition. And this is actually a sign that they're almost to acceptance. So as the next stage after this is acceptance. So as a therapist, understand it might be hard for the patient to engage in therapy if they're this depressed and in this saddened state. Patience is key, continuing to be a safe place for the patient to operate in. Understanding that again, it's not you, it's not like they don't want to hang out with you or do anything with you. It's that they're literally depressed at that they're dying. And then acceptance is pretty much what it says. The patient has reached a point where they accept the finality or the terminalness of their disease, and the patient is now able to live in the present moment. This does not mean that they're happy all the time. Again, they could slip back into other stages of grief. That sometimes happens. But it means that they've come to term with their condition and they're able to talk about it in healthy ways. So like now as a therapist, you can kind of talk about things with them. They might start asking questions like, hey, what about like hospice and stuff like that? What does that look like? They might be more open towards those sort of conversations. And really, as a therapist with patients who have terminal conditions, we want to kind of think of this as more of like a hospice kind of scenario where we're not trying to fix the problem. Like the patient will succumb to their condition. We are trying to maximize their quality of life. So let's say that their goal is, I want to be able to dance with my daughter as a father-daughter dance at her wedding. Okay, we just want to keep them strong, keep them mobile enough, keep them from getting like blood clots and things like that so they're able to do that. It might just be they want to be able to sit in their favorite chair and get up out of their favorite chair while they watch their game shows. That might be something else they want to be able to do. They might still want to be able to get up and walk outside and watch the birds in the bird feeder and everything. These might be things that are important for the patient, and they require us to be able to keep them as functional as possible. So that's a kind of way we want to be approaching this with patients, keeping them as functional as possible for as long as possible to maximize their quality of life. That's the biggest thing. If we're doing things that are minimizing, like if a therapy session exhausts them for 3 days and they can't do anything for 3 days, then that's not the kind of intensity that we want for the patient. So being empathetic towards the patient, welcoming any conversation about their condition. Sometimes at this point, patients are actually able to give you a lot of insight about their condition and how to also help other people with their condition. I know I've treated patients who were dying from prostate cancer, and I've just had a lot of you know, insight from these patients and everything. And this is something that's outside of the boards, but just like as a therapist talking to you, who's going to be another therapist, it's okay to go to your patient's funerals, okay? If your patient passes away and you worked with them a lot and you're able to go to the funeral, the family is not going to be upset that you're there. They're going to be so happy that that patient made such a positive impact on your life that you're willing to, go to their funeral. I've been to multiple patients' funerals and they've all been beautiful. They've also helped me kind of close that chapter. These were all patients who were dying from terminal illnesses and stuff, but it helps me move to acceptance as well. And just kind of seeing their family and meeting everyone, it's a beautiful kind of come around and everything. Obviously maintaining HIPAA with the members of the family who don't know that you were the therapist and everything, but like if the wife brought him to every therapy session, they're probably going to start introducing you as like, oh, this was so and so's therapist at PT and everything. That's totally fine. It's a good thing. And this is more for outpatient people, inpatient people. If you guys want to, I just know you guys don't spend as much time with your patients and don't get as close to them as outpatient people. So like acute care people, obviously long-term care people, y'all know your patients really well. So yeah, it's up to you if you want to do that, but as a fellow person in this profession, if you end up in the situation, don't feel bad about it. It's okay. You can go to your patients' funerals. It's a beautiful thing, and you kind of see how many people they also impacted positively because we're all human, and that's okay. I just wanted to kind of put that out there for you guys. The boards won't ask a question about that, but just wanted to be my little aside for those of you who might be going through this. So let's talk about the sample question. A physical therapist assistant is treating a patient diagnosed with amyotrophic lateral sclerosis. The patient has frequent outbursts directed at any medical staff that would listen, yelling about extra tests and asking questions like, why me? What stage of dying would the therapist expect the patient to move into next? One, anger. Two, acceptance. Three, depression. Or four, bargaining. So I'll give you guys a moment to think about this one. All right, so the correct answer is bargaining. So you might be like, why isn't it anger? The stem of this question says, which stage of dying would the therapist expect the patient to move into next? So this is describing anger. Okay, you're not wrong. This is the patient in anger. After anger comes bargaining. Okay, so this is asking about what are they moving into next. That's why it's important to know the stages. So again, let's just go over the stages real quickly. We have denial, anger, bargaining, acceptance, bargaining, depression, and then acceptance. So let me go over that one more time since I messed up. Denial, anger, bargaining, depression, and then acceptance. DABDA, if you want to use an acronym for that. But that's pretty much what this is asking. So it's important you're able to, one, diagnose what I guess not diagnose, but identify which stage the patient is in. And then knowing the order is helpful as well. So you can kind of start seeing the signs of like, okay, now this patient is starting to move into like the bargaining stage. So they're yelling at people, they're asking questions like, why me? Like kind of thing. They're definitely in that anger stage of their kind of questioning what's going on and in very emotional sort of ways. So hopefully that this was helpful in understanding things and you learned something. I will see y'all in the next one. Take care, friends.